Hi class, this is my presentation for this week's discussion board posting, and my topic is intrahepatic cholestasis of pregnancy. So epidemiologic factors. So ICP represents a form of liver dysfunction that occurs exclusively in pregnancy. An increase in bile salts are present due to this liver dysfunction, resulting in an increase in the amount of serum bile salts deposited into the skin, where then they can cause pruritus or severe itching. The prevalence of ICP it's a rare disorder affecting 0.5 to 1.5% of pregnant women within the United States. Women with twin pregnancies are more likely to be affected by this disease. The incidence of ICP, it typically manifests during the third trimester. ICP of pregnancy has a recurrence rate of 60 to 70% in subsequent pregnancies, so that's something to keep in mind if we do have a patient with cholestasis with their first baby, if they're planning on getting pregnant, just some patient education to definitely keep in mind. And then the transmission. There's no transmission from patient to patient or woman to woman. ICP simply may develop within the woman's body during pregnancy. Maternal and fetal risks. So as you can see, the risk factors for the infant greatly outweigh the risk factors for the mother. It is also important to note that maternal symptoms typically resolve shortly after birth. So for maternal risks, excessive itching with resulting secondary skin lesions due to the itching itself. Major fetal risk, so definitely keep in mind here, preterm birth, abnormal fetal heart rates during labor, meconium-stained fluid, respiratory distress upon delivery, potentially fetal demise, and stillbirth. So definitely important if we have a patient with cholestasis to stay up to date on fetal well-being, monitoring, prenatal visits, and all of that. So subjective patient presentation. Itching, particularly on the hands and feet, dark urine color, pain in the right upper quadrant, pale light coloring of bowel movements, fatigue, exhaustion, loss of appetite, or depression. The classic presentation of ICP is sudden in the third trimester of intense itching of the hands and feet without any associated skin lesions. Less common symptoms might include jaundice or nausea. As the itching is typically worse during the night, the patient may experience a disruption in their sleep, so something to keep in mind as well. So objective. There is a wide variety of lab work that should be completed that will provide an objective presentation of the patient. The lab work should include your elevated total serum bile acid, liver function tests such as AST and ALT, the bilirubin level, along with ALP and ALK as well. Here we have a picture depicting the various symptoms and treatment for cholestasis. So we can see the symptoms up top on the right, intense itching, everything we just went over. The treatment, which we'll go over a little bit later in the slide as well. Early delivery, monitoring, so that's really important to keep in mind. Definitely want to deliver between 36 to 37 weeks, and then just keep in mind, the symptoms, diagnostic factors, liver function tests, so we can see on the bottom left as well, everything like that. So differential diagnosis of ICP. So primary dermatological disorders can often be excluded from a differential diagnosis list. However, skin disorders during pregnancy should be considered, as should the following differential diagnosis I have here on this slide. Women who do present with visible jaundice should be evaluated for conditions such as hepatitis, HELLP syndrome, metabolic and hemolytic diseases, or other causes of hyperbilirubinemia, along with allergic dermatitis, bacterial rash, viral rash, scabies. Due to the itching, possible lesions from the mom from itching as well could relate to scabies, but these could be differential diagnosis for ICP. So diagnostics and screening tools. A diagnostic marker for ICP is the serum bile levels. So levels greater than 11 with an absence of primary skin lesions does support a diagnosis of ICP. There are 3 classifications for serum bile levels and ICP, which are mild, moderate, and severe. So mild being within the range from 10 to 19.9, moderate being in the range of 20 to 39.9, Severe ICP would consist of a serum bile level greater than 40. So the goal for treatment of ICP is to keep the serum bile levels below 40. And then as we can see here, Like we mentioned earlier, some of the different screening tests that we're going to do on mom, liver function tests, total bili. Coag studies can also be important, such as PT, PTT, and INR. But like I just mentioned, the specific diagnostic marker really for ICP is the serum bile acid levels. So, treatment plan. When ICP is suspected, pharmacologic treatment should begin immediately. So, ursodiol is considered the primary treatment for ICP. The recommended dose is 15 milligrams per kilogram a day with a max dose of 1,000 milligrams daily. This medication improves bile flow, thereby reducing bile stasis, resulting in an improved clinical symptoms and liver parameters as well. Some other non-pharmacological treatments that might help the patient include soothing baths, topical lotions, emollients, and antihistamines as a sleep aid, although it's important to note that antihistamines such as Benadryl, anything like that, typically will not help the itching, but they can help as a sleep aid. Treatment plan continued. So here we'll talk about fetal well-being, patient education, and follow-up. So fetal well-being is important to keep in mind as there are many risk factors for the infant that we've discussed earlier in the slideshow. So fetal well-being, as soon as ICP is diagnosed, fetal well-being definitely needs to be a top priority. With fetal movement counting, umbilical artery Doppler studies, ultrasounds, NSTs, BPPs, everything like that. It's really important for the patient to understand the importance of the fetal well-being and follow-up appointments, along with taking their medications. The ursodiol can definitely help the patient with their diagnosis of ICP, so it's definitely important that they make sure that they have a good regimen for that. And then, like I mentioned earlier, planned delivery between 36 to 38 weeks gestation is recommended for women with ICP. And then here are my references. Thank you.